Data everywhere. Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Science and Public Policy at Walden University. And in this video / podcast, if you're listening to the audio, the title of this, I'm going to be going over an article, and this was actually published in 2019, so not too dated. Name of it is Big Data in Healthcare, and this is actually about a 25-page paper. It's Big Data in Healthcare Management, Analysis, and Future Prospects. So let's get started here. So they start off by saying what big data is: massive amounts of information that can work wonders. It's of special interest, especially in the past 20 years, because of the potential that is hidden in it. Various public and private sector industries generate, store, and analyze big data. So this is already here. No matter if you understand big data or not, people are using it everywhere. So medical records, hospital records, all of these things lend to big data. Results of medical examinations. So remember, big data needs to pass some of the V's. So it's not necessarily volume. There's variations, which means that multiple sources work together, multiple stakeholders work together to create some data. So there's a lot of big data and a lot of sometimes confusion about what big data is and what it's not. Otherwise, seeking solutions by analyzing big data quickly becomes comparable to finding a needle in the haystack. So there are various challenges associated with each step of handling big data, which can only be surpassed by using high-end computing solutions for big data analysis. So computing solutions, I actually experienced this. It takes hours. Some of the big data analysis tools actually take about 4 hours in a computer that I built to increase memory. So there's a lot of understanding of how to completely analyze big data. So if we look through some of the subtitles, this might give you an idea about, and they talk about personalized medicine at the end. So there's a lot of things going on, and the introduction, of course, is worth reading. I'm going to give you some highlights of this since I went over it before I made this lecture. There's an introduction of digital universe. This is another good term when you're talking about big data. The International Data Corporation, IDC, estimated, this is very important, estimated the approximate size of the digital universe in 2005 to be 130 exabytes. Yes, I said 130 exabytes. Just to give you an example, the digital universe in 2017 expanded to about 16,000 exabytes, or that's the same as 16 zettabytes. At that level, there's really no understanding of what is going on. There's so much data. And then the International Data Corporation predicted that the digital universe would expand to 40,000 exabytes by the year 2020. And of course, this was about 2 years ago from 2020. To imagine this size, we would have to assign about 52,000 gigabytes of data, and that's a lot to all individuals. Most hard drives are 1 terabyte. Doesn't even get to the volume of exabytes or zettabytes. So this exemplifies giants. The internet giants like Google and Facebook have been collecting and storing massive amounts of data. So again, thinking about some of big data and whatnot, Facebook stores Facebook stores and analyzes more in the range of 30 petabytes of user-generated data. So you're getting the understanding of how much data, in fact, each of these put out. So the data overload, we went over that. Defining big data, that's now important too. Big data represents large amounts of data. That's true. Most people don't understand is the variation. While one of the V's is volume, the big part of big data is indicative of its large volume. Again, there's 3 V's: velocity, and the other V, I'm trying to find out here. So again, the 3 V's include volume, but also velocity and variety. And the 2 V's that I mention at the end is usually ignored. Of course, veracity is important as the 4th V, but not only that, volume, velocity, and variety. So then there's the term big data, and this was, by the way, the 3 V's were introduced by Douglas Laney. Laney observed that big data was growing in 3 different dimensions. So then they introduced machine learning, healthcare as a big data repository, things like that. So healthcare is required at several levels depending on the urgency of the situation. Professionals serve it as the first point of consultation, for instance, primary care. Then, of course, acute care, secondary care, advanced medical investigation and treatment, tertiary care, and highly uncommon diagnostic or surgical procedures, quaternary care. So all of these different cares can be considered big data. So how long does big data go back? You might be surprised that the papyrus texts from Egypt, by the way, I had a papyrus plant, and that dates back to 1600 BC. So again, in Stanley Reiser's words, the clinical case records freeze the episode of illness as a story in which patient, family, and the doctor are a part of the plot. Again, this is Stanley Reiser's words. So again, the case reports are actually from the papyrus text from Egypt. So then there's electronic health records that they go over. There's a All of Us initiative, which I've actually lectured on already. So you can go through my list and take a look at that. And then they go through some of the figures here, how the workflow of big data takes place. And I've talked about omics data in some of my lectures, but sensing data, electronic health records, public health record, and then clinical data is what creates the data warehouse. And then some of the analytic tools that are used is descriptive, diagnostic, predictive, and prescriptive. So predictive goes to the diagnostic and keeps going like a loop. Again, improved outcomes are smarter and cost-effective decisions. So then there's payer-provided data, electronic medical records, and practice management software. Then there's big data in biomedical research, like a human cell exhibits molecular and physical events of complex interplay. So number of publications have definitely risen from where it was in 2000, and then look in 2012 what starts to happen. The interest in publications just skyrocketed here from 2012 onward. It's just been going up and up and up. So big data from omics studies, this is important. Now multi-omics. So I went over in part of my big data book, genomics, transcriptomics, proteomics, metabolomics, glycomics, fluxomics, epigenomics, and then phenomics. So these lead to not only data integration, but electronic health record, clinical information, patient health records. When it's integrated, then you can lead to personalized treatment. And then, of course, personalized treatment then goes back to healthcare analytics. For the interest of time, I'm not going to go over too many more, but Internet of Things is a big sort of recent finding to assess an individual's health status. Biomolecular and clinical data sets need to be married. One such source of clinical data in healthcare is that Internet of Things. So those are kind of 2 lines to note. Advantages of Internet of Things in healthcare: a doctor can measure and monitor various parameters from his or her clients in their respective locations, for example, home or office. And most recently, what I'm going to look at. So I'm about to take a sleep study, and in the sleep study, there's a lot of information that's generated. And if you take multiple patients having a sleep study done, then you'll have massive amounts of data where you can compare sleep waves or other data that has been collected in many people. So these are opportunities for use of big data, Internet of Things, and other important developments. So mobile computing and mobile health, mHealth, this is something that I encountered first in Johns Hopkins. Nature of the big data in healthcare. There's organizational framework, management and analysis of big data, and then going into Hadoop, which is a big data has memory of even the most powerful of computing clusters. So this implements MapReduce algorithm. And then we're going over the Apache Spark, machine learning for individual information extraction, data analysis and predictions, extracting information from EHR datasets. And they're talking about natural language processing, which is a technique in artificial intelligence, is a rapidly developing area of machine learning that can identify key syntactic structures. So natural language processing is very much a useful tool in this in this type of electronic health records. So then there's image analytics. There's, like, for instance, I was telling you about the EEG from the sleep study, and then some of the sleep patterns, so in the sleep cycles, there's stage 1, 2, 3, and 4, and then there's places where other types of EEG is created, and then mammograms as well. There's data coming out of that. So image analytics is that looking at images and creating ways to analyze that data. Unfortunately, this table is kind of to the side. Again, big data this is a good place to look at this from Omics, big data from Omics. So there's Spark, SEQ, SAMCA, ART, distance mapping, SigWare, Cloudburst, and Hydra. And then BlueSnip is an R package, and then Myrna is cloud-based pipeline. So then there's other acronyms that you can go over. This table is good too. It lists some big companies which provide services on big data analysis, and there's quite a few out there. And then it goes into Linguamatics, which is again natural language processing. Here's a figure on ISI and how the workflow is. this is an important portion, IBM Watson now. And so that's IBM Watson in healthcare data analysis and analytics. And then there's storage challenges, cleaning challenges, a unified format, accuracy, image pre-processing, and security. And then there's metadata, querying, visualization, data sharing, big data analytics for cutting costs, quantum mechanics and big data analysis, quantum computing and its advantages. So quantum algorithms are actually, again, large pieces of data in machine learning, artificial intelligence that can be applied and analyzed in a significant manner. Applications in big data analysis, and then we get to the conclusion and future prospects here. It took a lot of time to go over this article. Initially, I went over it as well, and I wanted to share some of this wisdom coming out of this article itself. I hope this has given you some information and context about big data in healthcare as it applies to healthcare. And so from this, you can understand specifically what is going on in terms of Internet of Things, electronic health records, and how to align these so that there's a possibility for big data applications. Thank you for listening.